My name is Mochato David. I'm a nuclear medicine registrar at the Universitas Academic Hospital in Bloemfontein. The Oncidium Foundation is a global non-for-profit organization whose key mission and goals is to raise awareness around cancer, educate and support patients. As a local South African Oncidium ambassador, one of our key missions is to be able to, through strategic partnerships, support the organization, raise awareness around cancers as well as educate patients. One of the most important factors is being able to, through the RLT Connect platform, link patients with the suppliers in being able to access radionuclide therapies. We are very grateful that through the RLT platform and the Oncidium Foundation, we've been able to afford one of our patients one of the first donated doses of lutetium-177 PSMA to a patient who has prostate cancer. We are very grateful because we have seen him through the beginning until right now where he's doing much, much better.
My name is Professor Ewawa. I'm a nuclear medicine specialist based at the University of the Free State and Universitas Academic Hospital. As a nuclear medicine physician, I administer radioligand therapy to patients who have prostate cancer. We have groups of patients with prostate cancer that have disease that has spread around. We call them metastatic castrate-resistant prostate cancer. So usually these patients are very ill, and most of the times they have little options left for their treatment. We are able to administer such treatments here at Universitas Academic Hospital. Good for us, we have the staff, we have the manpower, we have the equipment to be able to establish this treatment to these patients. However, a serious bottleneck is we know that this treatment is very expensive. So these patients are treated with lutetium PSMA. Several clinical trials have shown that this treatment is very beneficial to these patients. It improves their overall survival and it gives them a very comfortable lifestyle, even after they've been very sick with this disease. So in South Africa, for example, this treatment costs about 70,000 rands for one dose. And a patient needs a minimum of 4 doses. So we're looking at about 280,000 rands. So this is very difficult to get. Patients cannot afford this treatment. Even our government hospitals, difficult to get doses for these patients. So sometimes we have to depend on donors. And we have a beautiful foundation, an international NPO, it's called Oncidium Foundation. And they've been able to donate some free doses for us to at least treat one patient. So we really have to make sure that we are selecting the best sets of patients who will benefit from such treatment. One of the beneficiaries of this treatment happens to be a young man who was very ill with prostate cancer that has spread everywhere. He practically came to us on a wheelchair, very sick. We were able to conduct several tests on him to see if he qualified for the treatment. So the patient was properly clinically managed. We staged the patient. We performed the nuclear medicine scans for the patient with our gamma camera here to be able to decide if this patient is going to benefit from the treatment or not. And then with all the investigations we did, we were able to put things together to know that this patient is likely going to benefit from the treatment. So we explained everything to him. He was willing to take the treatment because, like I said, he had little or no option left. This is a patient who was very ill, and in the next couple of months, he was most likely going to pass on. So we started the treatment for him, and the remarkable improvement just after one dose is a testament to how good this treatment is. So when we treat these patients with lutetium PSMA, most of the time, you begin to have good therapeutic effects within the first few weeks of the first dose. They start noticing that their bone pains start reducing. By the time they're coming for their second dose, patients who are going to do very well, you find out that their blood PSA counts that were very high might have fallen to a lower level. and then you begin to know that this patient is likely going to benefit from the treatment. Clinical trials have shown that this treatment is very effective. It improves the quality of life of these patients. It improves their overall survival. And this very patient in particular is a living example of how good this treatment can be. And we are so grateful to the Oncidium Foundation to be able to donate 4 doses of lutetium PSMA to treat patients all the way in South Africa. We thank you.
Nakalibizo ke David Mochato Mokoena ke tswa Bethlehem botlhokong ke sepetlele mona Investors ke dilemo di 65 ke phetse bophelo bonana bo bohloko bona ba cancer a ke fihla dihlabeng a thola ke na le cancer ya botona ke 2019 eno after 2020 21 22 23 yampokela ke fihla doctor Koloi ai batla isearcha ke khutla ha ke khutla mo ba re ya le ena selempe se batla dikimo go gomela Bloemfontein go tla ga ka Bloemfontein ke qetile selemo kaofela ke tsamaya kimo ke le national ana Bloemfontein 2024 yan change national yang rela Investors after Investors ke fitlile Investors mona ke sa tsebo tsama ke tsama ka wheelchair uno sina ntwe kenang honna uno sina ntwe a ke re ke nwa metsi a khuta a ke re ke a jadi a khuta uno sina ntwe kenang ke tsama ka wheelchair walo ha khonu ikisa ntwaneng a khonu yetsa next Investors ya lwantsha nsela migane mingata ka phahama migane ne bantsela ona yo e matla khatla pele a ke thoma ba thoma ke tsa ntho una lo mo ne ba bantla ba ona kutlwe milona kona ka hlatswa dina le tika ofela ke rempe fela ke tsetse ma ka mara go isa fedising pele bo ma 7 to 10 minutes ke kutlwa ga ikona ke nne no manai nga ke tama di tsogo ba wa khatla bedi tsa tse ke ya ka bona ona petrolating ya ke mo ke khona o ja hantle mugano ano ke kwa ya se tsantle wa na tshena ke khatla ba a ikona ke ikutlwa wa che wheelchair isa ba ke ya wa ke mo se khona ka ikisa bohle bo ba tlang ya teng sa tsilena la ka jeno e tsa April ke toetsa treatment ya ka ya go katela le ya bone ke le wa sepetlele ke le wa di doctor ke le wa bohle ba no ba bile di thuso plaka ka bophelo ba ka mugane na ya tuwa ke a leboa Oncidium Foundation ke ska ba go nna fela batho bohle e kenyeletswa o sebetsa ka mokgwa se bena ke neng ka o ke a leboa.